Good morning. It's a pleasure for me to be here with you for the American Heart Association's Go Red for Women Luncheon. My name is Jeffrey Van Hook. I'm an interventional cardiologist and the medical director of the Structural Heart Disease Program at AtlantiCare Regional Medical Center. What we'll talk about today is the importance of heeding heart health and how our lives have changed in a post-COVID-19 world. We'll discuss the case of a friend of mine who suffered significantly from COVID-19. We'll talk about how the disease affects the heart, and most importantly, how we've adapted to this disease and how we make a comeback. We'll open up with two cases. Both of these involve women. As you all know, women are usually caregivers. Women tend to be focused on caring for others and tend to put their own health second. The first case is a very nice 36-year-old lady who came to the emergency department with symptoms of a very significant left-sided stroke. She was given clot-busting medication, and because she presented very quickly, her symptoms resolved over the matter of a couple of hours. She had a thorough workup and was diagnosed with a patent foramen ovale, or a PFO. This is a hole in the heart between the two upper chambers, and it's a residual defining from what we had before we were born. It normally doesn't cause any symptoms, but because this patient had such a significant stroke, we evaluated every other possible cause of her stroke and came up with nothing. So in a multidisciplinary approach, including neurology, we decided that this was the most likely cause, and we brought her into the cardiac cath lab. We performed a percutaneous PFO closure, all done through a needle stick in the groin. Procedure as a whole took about 40 minutes. She was discharged the next day and is living a completely normal life. The second is a 76-year-old lady who suffered at home for 2 days with chest pain. When she finally came to the emergency department, she was extremely unstable and had to be placed on the mechanical ventilator. We brought her for an emergency cardiac catheterization, and we found a completely blocked artery. What we also found was a very large hole between the two pumping chambers of her heart. Because she came so late in her disease process, she had actually torn the muscle. She was referred for emergency cardiac surgery, and unfortunately, after about an 8-hour surgery, she died. The difference between these two cases, between a good outcome and a bad outcome, was how quickly the patient recognized their symptoms and presented for care. Unfortunately, what we're seeing in this post-COVID-19 world is that people are delaying their care. If we think back to February, we were all gathered together for American Heart Association Month. We were discussing the importance of awareness and treatment. Back in March, our providers were reading to staff, talking to students, and doing educational programs for the community. We were still seeing patients in our offices. We were doing interventional procedures, including cardiac stents, cardiac surgery, procedures to treat abnormal heart rhythms called ablations, and we were doing structural heart cases, plugging holes in the heart and replacing valves. Then COVID-19 came. We had to move from a world of absolute reality, seeing patients, to one of virtual reality. Think back to 2 years ago for American Heart Association Spring Heart Walk. Back 2 years ago, it was a cold and rainy Saturday. We were all huddled in the convention center in Ocean City. We were under umbrellas and blankets. Fast forward to this year, and everyone had to do their own thing for the Heart Walk. We had to do it virtually, recording it, posting it on social media. Almost overnight, we had to change the way we delivered care. Offices had to close and hours had to be reduced. We had to learn to use telemedicine to reduce the spread of infectious disease. We had to restrict visitors in the hospital. A term we had never heard before, social distancing, became the norm. Now we've begun the process of reopening. We've had to work to reassure patients, to reassure the community that it is safe to come to the hospital or to their doctor's office for care. At the same time, we have to remain vigilant, not only for the COVID-19 pandemic, but for the pandemic of cardiac disease which will be presenting, that's been undiagnosed, neglected, or had treatment delayed while we as a society were under lockdown. Throughout the world, there's been a decrease in non-COVID related emergency visits. This has primarily been because of increased fear the patients had in calling 911, and this has led to an excessive amount of death at home. In Europe, they saw about a 50% decrease in non-COVID related visits, and our experience has been similar to that. Our EMS providers are sharing with us that the most difficult experience they're having on calls is the challenge of reassuring patients that the danger of delaying needed care, especially urgent and emergent care, is greater than the risk of COVID-19 infection. This is a figure from the Center for Disease Control. The blue mountains that we see towards the right are the COVID probable and COVID confirmed deaths in New York City. The black line is the excess of deaths during the same time period. So what this tells us is that patients who would have been coming in for care for emergent things such as heart attacks have been waiting at home and are being found, unfortunately, often deceased. The virus can affect the heart in many ways. It can cause myocardial injury, which is muscle damage through blocked arteries. It can also directly affect the cardiac cells. It can exacerbate congestive heart failure. It can cause abnormal heart rhythms of both the upper and lower chambers of the heart. It can cause blood clots, and as you'll see, it can cause stroke. Very severe cases can cause patients to be in shock and need very advanced circulatory support. Some of you may have seen this in the newspaper. This is Dr. Troy Randall. He's a friend of mine. We were medical residents and cardiology fellows together. He was working in the hospital and became infected with COVID-19. He had a relatively mild course and recovered. But shortly after recovering, he woke up with terrible headaches. He ignored them for a little while, and then his wife, who's a registered nurse, convinced him to go to the emergency department. An MRI scan there showed that he had had a significant stroke. This was felt to be related to a COVID-19 caused blood clot. He's done well since and has had a lot of recovery, but he still has some residual dizziness. I talked to him last weekend, and he told me he was back at work, but working in the office. He hasn't been back in the hospital yet. He's only doing outpatient medicine. When I asked him how he was dealing with everything, he told me that his biggest struggle was emotional, dealing with the slower pace working in the office. He wants to get back in the fight. So what's worked through this pandemic? Well, telehealth has been of critical importance. Cardiologists, primary care, urgent care, other specialists, we've all linked together. We've done everything we can do to prevent patients from coming to the emergency department who didn't need to be there. But at the same time, we've encouraged patients who need to come to the hospital to do so. We've used technology to connect hospitalized patients with their families. FaceTime, Skype, and Zoom have been critical. These technologies have also allowed us to work together as care providers. A few months ago, as a structural heart team, we would sit around the table planning TAVR procedures. That's a transcatheter aortic valve replacement. It's a minimally invasive alternative to open heart surgery. We used to all sit around one table. Now we have a virtual meeting, and we even do some virtual consults with patients. What we need to take away from this experience is the importance of heeding our heart health, of seeking care, getting routine, specialty, and emergency care. The COVID-19 pandemic has delayed care, and it's resulted in increased death, not only from the virus, but from the fear that it's spread. It's delayed cardiac care. It's delayed stroke care. We need to know our role in preventing the spread of the infection and our role in preventing death from heart disease at the same time. We know that there are multiple cardiac effects of the virus, and we know that healthcare organizations are open and following CDC guidelines so we can safely provide care. Let me close with a bit of a heartwarming tale. This is Laura Thompson. She's 81 years old. She had a severe narrowing in her aortic valve. She went to her AtlantiCare cardiologist, who referred her to us in the structural heart disease clinic. Because of the severity of her condition, we recommended she undergo transcatheter aortic valve replacement. Her daughter lives in London. She'd planned to be with her for the procedure, but because of visitor restrictions and because of an absence of flights, she couldn't come in. So what we did, we connected with Laura's daughter by FaceTime. She visited her regularly that way, and we were able to keep her informed throughout her procedure throughout her hospital stay of what was happening. And both people said that they were never worried about COVID because we'd explained the extensive precautions that we were taking. Thanks to our use of technology, a multidisciplinary approach, and careful attention to infection control practices, we were able to successfully treat 15 critically ill patients with advanced aortic valve disease in a minimally invasive manner during the pandemic, restoring quality and years to their life. Thank you.